Last video of the day. This one actually came, didn't I get this from a patient earlier that asked me this question?
Yep.
Okay. They just asked a legit, really actually awesome question. They asked me, why do I feel worse in the morning when I first get out of bed? And I thought, let's make a video and talk about that. So a lot of people get up out of bed, and for some people it's like that impending doom. You're like, you gotta take a couple of deep breaths in because you're not sure how those first steps are gonna be because you're pretty beat up. If you've done some dumb things like me over the years, like bash your head against other humans and played football, a lot of times you have some disc injuries, and those disc injuries are actually a little worse in the morning. So I wanted to go over why you feel worse in the morning, especially in the neck, in the low back. One thing that happens is in between here, these are the bones of your back. They're called your vertebrae. And in between them is the disc. The disc is a really good shock absorber. So it handles force like this all day long. So a lot of people out there have disc bulges, disc herniations, all sorts of problems with that, which is bad enough. So what happens is if we cut your disc in half, in the middle here, it's got this toothpaste substance and it's surrounded by these rings. So the disc is like a hydraulic pump that pumps all day long. So when you actually go to sleep at night, gravity isn't acting on you as much. So the disc actually gets bigger as you sleep and starts to expand. So if you have some of those pathologies in there, like a disc bulge or a disc herniation, it's gonna bring this out even more, and then this starts to seep out. So when you get up in the morning, you're really stiff, really beat up, but as you get moving, you feel better. People always wonder why they feel better when they get moving, because then the pump starts pumping again, and this starts to shrink up. And then by the end of the day, when you do lay down, it's not too bad, but that whole cycle starts all over again. So the reason you feel worse in the morning is because you do have a disc injury, and it's bringing that pump out bigger. So interpret the symptoms, understand what's going on, and don't just think that it's old age or you're just not healthy or something like that. There's always an underlying cause, and getting to the root cause of that with a good doctor, usually one that's trained in integrative diagnosis, will really help you get a full resolution for your problem and get feeling better. So see you guys bright and early tomorrow morning. Have a good night.